My name's Joshua. I'm a pre-hospital nurse practitioner based in Norwich centrally, and I have been doing the role for 6 months. My background in nursing, so I've been qualified as a nurse for just over 10 years in various roles, including acute medicine and critical care. More recently as a critical care outreach nurse, and employed also within the ambulance service as an emergency clinical advice and triage clinician. One of the biggest things that interested me about the role was the ability to be able to use my nursing skills within the pre-hospital emergency medicine environment for the ambulance service. I think that was the biggest kind of draw without the need to retrain. I'd always wanted to work within the ambulance service. I'd looked at various other routes, such as retraining as a paramedic. So when this role came up, it was kind of a no-brainer, as it gave me that opportunity to be able to utilise all the skills and knowledge that I'd gained over the period of kind of the last 10-11 years within the pre-hospital emergency environment. The role itself involves a bit of everything. So as a pre-hospital nurse practitioner, you will predominantly be working to a paramedic scope of practice, but using your nursing registration. It involves kind of clinical decision making, using kind of leadership skills. It involves the ability to kind of need to think on your feet or change plans. Sometimes it's a bit of negotiating with patients and their families around what pathway is best for them. So I think the thing I enjoy the most about the role is how varied the role is. So as I said, you can go to lots of different jobs, and each job can be different in presentation, and the environment itself where you're travelling to is different, which is quite nice, because no two scene or job is the same. One minute you could be attending someone who's really unwell, pre-alerting them into hospital, ensure they remain stable on the way, and your next job could be finding an alternative care pathway for a patient and managing their complex health needs within the community. I think the thing that people may find most surprising about the role, and certainly one of the biggest things for me, was how similar the scope of practice is to the paramedic. Essentially you are working to that scope, but just against your nursing registration. So you've got a lot of freedom, a lot of autonomy when you're kind of out on the road providing care for patients. Yes, 100%, absolutely. I joined 6 months ago, back in March permanently, and I've enjoyed every minute of it so far. The training that you get is really good, and there's a lot of support as well from your colleagues when you transition out onto the road. So I think coming from an acute hospital setting prior, there's a really good pathway to kind of enable nurses to transition from whatever kind of background of nursing they come from into the pre-hospital ambulance service kind of environment.